Okay, so this is bones. So I used this picture in the skull. So one thing, remember that you know the difference between the axial skeleton and the appendicular skeleton. So axial is the skull, the rib cage, and the vertebrae, and the appendicular is everything else, right? So the appendages. So we'll start with the vertebrae. So this is part of the axial skeleton. Okay, we already did the spinal nerve, so this shouldn't be too bad. So there are five regions of the spinal cord. Okay, so cervical, thoracic, lumbar, sacral, and coccyx. Okay, so if we start to look at them, and you could actually count them, right? That's how they're identified, is by counting them. So if we start at the top, we have C1, C2, C3, C4, all the way down to C7. Okay, and then for thoracic, we have 12. Okay, lumbar, we have 5. Sacrum, we have 5 bones that are fused together. And then coccyx, we have 4 little vertebrae that are fused together, so the tailbone, right? So there are curvatures in them that are typical. So we have a cervical curvature, thoracic, lumbar, sacral. In between each vertebrae, there are intervertebral discs. So the discs are made out of fibrocartilage, and they are going to resist stress and pressure. Okay, and I'll show you pictures. So these holes here, these are where the spinal nerves actually exit the spinal cord. A couple things that you should know. So C1 is what articulates with the skull, and they call it the Atlas. So in, I think, Greek mythology, Atlas was the man that held the world on his shoulders. So Atlas is the first vertebrae, and the skull, it would be like the world. Okay, C2 we call the axis. Okay, so it has a special name too. Okay, C7 is, they call it the prominence. It has, and if you feel the back of your neck, okay, if you tilt your head down, right? So if you tilt your chin to your chest, you can feel the prominence coming off of C7 at the, right at the back of your neck in between your shoulders. So that's the end of your cervical vertebrae. Okay, now let's look at the parts of the vertebrae. Okay, so if you take one of them and you start to look at it, okay, you're gonna see, okay, so this is the looking from the top down, so superior view. Okay, so this is the front of the body. Okay, and this is the back. Okay, and you kind of see these things coming off of it, okay? So the thing that comes out the back, that's called the spinous process. So if you are skinny, or you could even do this with your cat or your dog, right? You can run your finger down the back of their spine, and you're feeling the spinous process. Okay, the transverse processes come off of this from the side. Okay, now there are facets and processes on these. Okay, so there is a superior articulate facet, and that's where it's going to articulate with the next vertebrae on top of it. The vertebral foramen is just the hole in the middle of the vertebrae. That's where your spinal cord is going to be. A process is anything that sticks out. A facet is a smooth surface. Okay, the body is the main, like the beefy part of it. Okay, so the vertebrae are actually shaped different depending on what region they are from. So they each have distinct characteristics. Okay, so if you look at this from the back, okay, so here's the process, the spinous process coming out. Here's the intervertebral disc. There's a transverse process, superior articular facet, and then at the bottom, you're going to have inferior articular process with a facet on it. Okay, if you look at it from the side, okay, here is the intervertebral foramen. So this is where spinal nerves leave. That's the body of the vertebrae. I hope that kind of makes sense. Okay, so if we look at these, so characteristics of cervical, thoracic, and lumbar. Okay, so cervical vertebrae, so the ones in your neck, have a transverse foramen. Okay, the other ones don't have that. So they have an extra little hole up here, and those are for blood vessels that are going to the brain. They also have a spinous process that has 2 prongs on it. Okay, most of the spinous process have 1 prong, but the ones in your neck have 2. They're little. The ones in your neck are little. They're a lot smaller than the other ones. Okay, so there's cervical. Okay, so now thoracic. I always think thoracic, if you look at them, they kind of look like a giraffe. Okay, maybe this is like the little giraffe ears, and this is the little giraffe. Let me show you. So there's the giraffe horns, I guess, and there's the ears. Okay, so if you look at it from the top, so this is the front, this is the back of the body, this is the front of the body, so they turned it around on us. Okay, so here's the superior articulate facet. Here's a transverse process, so they're going to articulate with the ribs. Okay, costal facets, that's where costal is rib. Okay, so they're going to articulate with the ribs. They're medium-sized. Okay, to me, they look like a giraffe if you see the giraffe. And then these, to me, look more like a moose. Okay, so here's like the little thing hanging off of their chin, right? And the big antlers. So these are just a lot thicker. Okay, so here's a picture. I shouldn't have left this in here. You don't need this. This is trying to show you a herniated disc. So what happens sometimes if somebody has a herniated disc, the intervertebral disc it gets damaged, right? And so some of the stuff that's inside of it starts to kind of push its way out of it. And when it does that, it can push on the spinal cord and it can push on the spinal nerves. Okay, so that's going to cause like tingling, numbness, pain. Okay, you don't have to know all those all those names. Okay, so here's the atlas, okay, and here's the axis. So the atlas and the axis are what allow you to turn your head and nod up and down. Okay, so nod yes and no, and turn. Okay, so what happens is they actually articulate with each other. So here's the atlas, so this is C1, so this is the top one. Okay, and here's the axis, which is C2, which is the next one down. C2 has this protuberance, okay, that's called the dens. The dens lines up with the atlas. So if you look here at this picture, okay, it comes up, it kind of they're anchored together. Okay, and that's going to allow you to turn your head, okay, and say no. All right, so atlas is the top one. It doesn't have a body. Okay, so no body in it. The axis is underneath of it. It has a protuberance and it has a body. And if you look, see the bifurcated, okay, spinous process, how it has 2. This one doesn't have any spinous process. Okay, so then the skull is sitting right on top of there. Okay, the sacrum. Oh, all I really have you know is that it's the sacrum. So sacrum is fused. It's your sit bones. Okay, the ribs, so 1 through 7 are considered true ribs. And the way that we name the ribs is we just number them 1, 2, 3, all the way down to 12. Okay, so 1 through 7 are true ribs, and then 8 through 12 are false. And then 11 and 12 are further subdivided, and they're considered floating ribs. So 1 through 7 hook to the sternum. Okay, so the sternum has several parts. Okay, so this part that sticks down at the bottom, that's called the xiphoid process. Okay, then the body of the sternum. And then this part is the manubrium. I'm not worried about these, okay? But the manubrium, the body, and the xiphoid process, those are 3 parts of the sternum that you need to know. Okay, so no, 1 through 7 are the true ribs. Okay, and they are going to attach. This is called costal cartilage, right? Which we've talked about. So the costal cartilage is going to connect the ribs to the sternum. 1 through 7 are considered true because the costal cartilage goes from the sternum to the rib. The false ribs, what happens is there's another connecting piece between the cartilage, like there's like 2 connections to get to the ribs. And then the floating ribs are not attached to the sternum. 12 ribs on each side. Okay, so not everybody is symmetrical. Okay, there's another, just don't worry about that. Okay, the ribs. Okay, so the ribs, they're actually like pretty thin and pretty light. Okay, so the ribs are going to articulate with the thoracic vertebrae, so 12 and 12, right? I am not going to, you don't have to know all the parts of the rib, just know there's 12 ribs. And it's cool how it actually all comes together. Okay, clavicle. So the clavicle is your collarbone. Okay, so the clavicle has, I think this picture is a good way to look at it. It has a sternal end where it's going to hook to the sternum, and then has a acromial end, and that's at your shoulder. Okay, so the scapula is your shoulder blade. Okay, so it's in the back of your body. Okay, so the acromion is where the clavicle and the scapula come together. You don't have to worry about the details. Okay, so scapula, this is looking at it from the front, like this. This is looking at it from the back. So there are lots of tendons and ligaments and muscles that make the shoulder actually function the way it should. So we're just going to kind of go over some general stuff for the scapula. Okay, so the scapula has a fossa on it, a subscapular fossa, and then on the back it has an infraspinous process. So there's a spine on here. Above the spine, there is a supraspinous fossa. Okay, so these are places where muscles are going to lie. Okay, acromion is just important because of where it hooks up with the clavicle. I mean, all of these are important, but right now we're just going to kind of just know some basic things. Okay, I'd be happy if you know it's the scapula. Okay, so here is the humerus. Okay, so the humerus has a head, right? This is the shaft of it. Okay, and then down here is, there's all the trochlea. Okay, I'm focused on, as you guys, knowing that this is the humerus. Okay, and that it's the top bone on your body. Okay, now the radius and the ulna. So radius and ulna, what you should know, so the radius, okay, if you look here, okay, so, and it's labeled like this, okay, so the radius runs to the thumb, and the ulna runs to the pinky. So somebody said, remember PU, pinky ulna. Okay, so it's hard to see on here, but the radius actually has its head is round, and the ulna, this is actually a U. It's shaped like a U. That's good. You just need to know the bones. Okay, the hand. So for the hand, okay, metacarpals are the bones that are covered by the skin. So they're the ones in your palm. Okay, the carpals are the wrist. And I don't make the students memorize all the bones of the wrist. Okay, when you count them, when you name them by counting them. So it starts at the thumb. So you go 1, 2, 3, 4, and 5. Okay, so the bones that are covered by skin are the metacarpals, and then the phalanges are your fingers. So the phalanges, you have a proximal, which is going to be closer to your body, and distal is further away. Okay, so, and then there's a middle. So this would be 1, 2, 3, 4, 5. So say somebody broke this bone, this would be the 5th middle phalanx that they broke. Okay, now the pelvis is actually kind of tricky. It's got lots of parts to it. Okay, so the pelvis is made up of a couple bones. Okay, so if we look here, so here's the sacrum, okay, and the coccyx. Okay, and then each little pelvis bone, they're not actually that little, are called os cocci. Okay, so an os cocci. Okay, and then the os cocci have 3 parts. And the 3 parts are the ilium, the pubis, and the ischium. Okay, so think of the ilium as your hip. So this iliac crest, this is your hip bone. Okay, the ischium is what you sit on. Okay, so it's going to be at the bottom, and the pubis is at the front. Okay, the big hole here is called the obturator foramen, and nerves and blood vessels are going to flow through those down to your legs and back up through, right? The sacroiliac joint is important because that's where the sacrum and the ilium come together. Pelvic inlet is just us going in, and pelvic outlet is just it coming out. Okay, the pubic symphysis is the juncture in the top. Okay, the acetabulum is where the head of the femur articulates. Okay, so let's look here. So this picture is trying to show you, well, I don't think you guys have to, you need to know ilium, you need to know ischium, and you need to know pubis. Okay, and I'm not worried about the notches or any of that kind of stuff. Okay, so here's another picture, and this picture is trying to compare male and female pelvises. So the female pelvis is generally it's better shaped for delivering a baby. Okay, so the opening is bigger at the outlet. The shape is just different. It's kind of hard to see from this picture, but I guess you can see it. Okay, there's a list of that. I'm not going to give you a male one and a female one and tell you to tell me what's what. It's just interesting. Okay, so now here we go to the femur. Okay, so the femur is the biggest bone in the body, so it's the top leg bone. And I'm good if you know it's the femur. Okay, this is the patella. So that's the kneecap. Okay, the lower leg bones. Okay, so we have the tibia and the fibula. I always remember fibula, a little lie is a fib, right? And so it's the smaller bone. Okay, and usually in anatomy, the longer the bone is, or the smaller the bone is, the longer the name is. Okay, so that's just the way it always is. Okay, so tibia is bigger, it has a shorter name. So tibia is the big bone. Okay, and fibula is the small one. And you can see pictures on here of how they articulate, how they come together. Okay, now your foot. Okay, so for the foot, calcaneus is the heel. Okay, and then the talus is where it's going to articulate with the tibia and the fibula. Okay, now I don't usually make you learn these, okay, but you need to know metatarsals. Okay, so that's what's covered with the skin. Okay, and then the phalanxes. Okay, and you just do it the same as you do the fingers. You count 1, 2, 3, 4, 5, and you count from the big toe. Okay, so the big toe is the hallux, and the others are phalanxes. Tarsals are the ankle bones. So you should know that. And that might be it. There's just another picture about it. It shows it. I think that's it.